It's again me and this live thing. I can't see it yet, so it shall be going now. I think we are live. Can you see, Antoinette?
Yes.
Yes.
Yes, it's counting. We're live, and we're just waiting for
ready
everyone to
go.
join.
Okie dokes.
So go and play the music.
I'm going to play it later. I've got this thing on. I can't find it. That's the problem.
I can't find it. Okay.
Hi, guys. Welcome back to Pawz People with your two aunties. I'm Rieta.
Antoinette. And Antoinette.
And the
hello.
show we are talking. This is the show where we talk all things pet for those that hasn't joined us before and the people who love them. Today, we are opening the medicine cabinet, homeopathy, and for our furry family. What it is, what does it help for, and where does it help for, and where you can get it.
Mm-hmm.
So, a good guess before we introduce it, Antoinette?
Yes, so our guest this evening is a pharmacist who swapped his dispensary for homeopathy. And he built a kit that's in homes across South Africa. And Ian Wheeler, welcome. He is the founder of Pegasus Homeopathics, B.Pharm degree from Rhodes, 30-odd years as a pharmacist. And then somewhere along the line, you sold the pharmacy, sailed across the Atlantic, and before you started training in homeopathy. So welcome, Ian. It's lovely to have you.
Thank you for having me. So I'm privileged to come and share my passion with you and the audience. Cool.
Brilliant, brilliant. Just, did the homeopathy happen during the sailing, after the sailing? What was the trigger?
You know, it's just really universal guidance that I did pharmacy first. I battled with my skin as a youngster, and I was in and out of the pharmacy on bloody antibiotics when I was, 15, 16, 17. And I just intuitively knew that this is not the right way to go. But I did pharmacy. I was interested in drugs, not street drugs at that stage, but drugs and how they worked, etc. And when I opened my very first pharmacy up in Joburg, actually out of the army days, I had a little Natura stand. They're one of our opposition, but they've paved the way for homeopathy. Wonderful. And I had no clue how it worked. Then I sold that pharmacy, and that's when we went sailing. And I did most of our sailing courses in Cape Town, Table Bay, Hart Bay, etc. And I said to my then wife, I said, should we come back to the country? This was 35 years ago. Could have lived anywhere. I'll come back to Hart Bay, and then I opened two pharmacies there. And then my intuitive draw towards natural medicine was very powerful. So I opened the two pharmacies, and I then opened a health shop. And then, as again, a universal guidance, Dr. Ruth Bloch invited pharmacists and doctors to a 3-year course where she gave her life's work. It was a great privilege to those that were interested. It was a 3-year course. I had two busy pharmacies. It was quite a commitment every Wednesday evening, Saturday afternoons for 3 years, pretty much. And, and I then saw firsthand what an incredible healing modality it was. And I knew my colleagues, and particularly the young mother, the lay person at home who doesn't have maybe a lot of medical knowledge, to empower them to heal their families and look after their families. But I must stress, for me as a pharmacist, it's very complementary. It's not an alternative, the one or the other. I used it in my pharmacies often to wean patients off of allopathic drugs, over-the-counter drugs, particularly where applicable. And I always tell people, my boys are 32 and 35. Can't believe it, but that's true. Time goes. And at the pharmacy, 4 of them over 33 years. Those 2 boys had each ever had one antibiotic in their lives. And on both occasions they had them, they were away from me. So if they were with me, they probably wouldn't have succumbed. The one got tick bite fever, the other one got a terrible throat infection. So it is my passion. It really is. Because homeopathy always tries to heal the cause, not just the symptom. And most of our allopathic drugs, they can be life-saving. But in my opinion, as a pharmacist, you want to use allopathic drugs as infrequently as possible and as for shorter time as possible. Look, there's some chronic diseases where people have to be on them, but homeopathy has been and is the medicine of the future.
Totally. Ian, in plain language, explain to us what is homeopathy and how is it different from herbal and natural remedies? Because a lot of people just lump it all together. So would you tell us what is homeopathy?
Okay, it's true. When we have expos, like I'm going to do the Mama Magic Expo in Durban, in Joburg, not this weekend, the following weekend, people often think it's aromatherapy or various other herbs. People don't understand. Homeopathy is made from many starting substances. Okay, some poisons. I mean, in our bites remedy, we've got snake venom, scorpion venom. So let's go back to arnica. I think most people know arnica. It's for bruising, swelling, trauma, bleeding. If you take the plant, in this case, the starting substance is Arnica montana. It's a herb. We macerate it, we mash it up, steep it in alcohol for a period of time. You will draw out the mother tincture. So it's herbal in this case. If you and I and everyone listening had to drink that, it's a foul, dark liquid. You will present with sore, stiff muscles like you've run a marathon. You'll look as though you've been beaten black and blue. You'll be bruised. You'll bleed from your gums, possibly other internal bleeding. So it's orally, it's poisonous to us. But if I produce from it a homeopathic arnica, it will cure exactly those symptoms. So like cures like. So that's a very simplistic example. The other example is the allium cepa, the red onion. You've all cut an onion in the kitchen, you know what happens. Your eyes are stinging, smarting, lacrimation, runny nose. So therefore, the allium cepa in homeopathic potency will be in the hay fever remedy or the cold and flu remedy, where you expect those symptoms to present. So the big advantage with homeopathy, what I practice is clinical homeopathy, not classical. We'll get to that possibly later. So clinical homeopathy, we complex the remedies together. And that's why we get such a good success rate. Because if everyone listening had a sinus episode and took the sinus remedy, their bodies will take out of there the remedy that is pertinent to them. Okay? So you don't need to diagnose. Obviously, having a medical background is useful, but you don't need to diagnose. You simply have to match the correct remedy to the presenting symptom. So it makes it very easy for the young mother at home to treat her family. Obviously, if they haven't had a decent response, a positive response within 24 to 36 hours, well, then see your doctor. You know, it might be something more sinister underlying. But the range that I've produced is for everyday over-the-counter common ailments, nausea, vomiting, diarrhea. But it's always trying to heal the cause, not just treat the symptom.
I'm a huge fan of homeopathy. I think my kids grew up with homeopathic remedies in our house for everything. And your little blue box has been my lifesaver as a mother and for children and now the pets. Also, I was counting the other day how many homeopathy remedies I've got in my house. It's actually scary. Got a whole cupboard.
But really, they never expire. As long as they're kept sealed away from moisture and strong aromatic smells, they are forever until they're finished, which makes them very cost effective.
Yes, great. And it is something that's actually easy to give. I always say to my dogs, you want some sweeties? And they know, and they come around. They love taking their medicine. So it's really a great remedy to have in your house. So I think I would like us to move into homeopathy in everyday pet care. Okay. Have we lost Antoinette? I think we've lost Antoinette. So I'll just carry on till I see her again. So, Ian, what kind of pet problems do you see homeopathy used for most? And where do you think it generally shines?
Sorry, what is your last part?
Where do you think it genuinely shines?
Okay, so people were using, I designed Pegasus in 2002. while I still had the pharmacies. When I sold the last pharmacy in 2018, I then designed the pet range. But people were using most of the human range for their pets. But I had time and then designed the more specific pet range, okay? And there's a crossover. There's a lot of similarities, and yet there's some very big distinctions as well. Pets, we use slightly different potencies, but in fact, when I teach the final year pharmacy students, they often challenge me when I explain how homeopathy is made. You know, it's a whole succussion potentization. It's a dilution. It's not diluting. It's potentizing. It's energetic medicine. They will say, well, it's purely placebo. You know, they used to milligram strength of drug per body weight, you know, whereas with homeopathy, when you dose, it's not a drug, it's a message. We are created very powerfully. We have an innate healing ability. God-given healing ability. And all that homeopathy, like the other energetic modalities, does, it initiates, it's a catalyst to initiate the appropriate healing response. That's, again, simplistic. It's like a lock and a key. You just need, so the worst thing that, if you give the wrong homeopathic remedy, the worst thing it'll do is nothing, because there's no lock and key. That's why you have to match the correct remedy with the symptom. When you do that, amazing things happen. So what I do is clinical homeopathy, okay? So it's very dangerous to put a bunch of chemicals together. That's called polypharmacy, dangerous. Drug interactions and side effect profile, not good. But with homeopathy, we have to carefully put them together. Some can antidote one another, so that's very carefully researched. But each individual person pulls out of the remedy that which they need, and the same with the animals. And animals they're like pure souls. They get the message where you and I might need 4 doses a day to treat a condition. Often people are at home, they see the animal in the morning and at night again. So they'll do like 2 doses before when they wake up, before they go to work. When they come home, do 2 doses, and that animal responds even faster than adults.
It does. And that brings me to something that I so often hear, where people say to us, but pets can't tell us whether they feel better or whether they don't feel, and what is going on wrong and so on. So how do you know it's not just the placebo effect? So with humans, I always say humans the placebo effect can play a big role here, but with pets it can't.
No.
And I have experienced firsthand with your injury range how Dr. Brendan sat on my floor with Riley and he gave her 1 every 10 minutes. And he sat and they did some needles and he gave her 1. And I thought, but give her more because they need to. And that one, and he carried on like that for 2 hours. He sat with her and every 10 minutes he gave her 1. And how she went from really very bad spasms and a serious injury to actually being almost okay in a matter of 2 hours. That's not a placebo effect.
Not at all.
If you can go a little bit about that.
So that's what I tell the pharmacist. I say every modality, every modality has some placebo effect. When you go to visit your doctor, you're not going there to get unwell. You're going there to get well. So already there's a placebo effect. But explain to me why a newborn infant, a dog, a horse, a cat, within 2 or 3 doses, you see the entire symptomatic picture change dramatically, you know. And then what I do, I let them watch the work of Dr. Emoto, the Japanese scientist who worked on water. And water has memory and consciousness. It's a whole lecture on its own. But I play that to them because that's how we believe homeopathy carries, even in a very diluted solution from the starting substance, it carries the message, you know. So, yeah, it's interesting.
No, it is a very interesting field.
Yeah. So, Ian, how do we know when to go to the vet? You know.
Okay. So the remedies that I've designed, we're not trying to do the work of the vet. We are the bridge between the retailer, the vet shop, the pet shop, and the vet. So, like Riet has just said, if there's an acute condition, you want the remedy at hand or start administering as soon as possible, and quite frequently. With homeopathy, a dose, whether it's you and I A kitten or a horse, it's 4 or 5 little pilules. We spray coat onto the sucrose pilules. They're just an inert carrier of the active ingredients. And sucrose, like honey, never expires, okay? So it's self-preserving. And sorry, where were we going with this? What was the question again?
when should we, like the red flags, to go to the vet? No, I'm so engrossed in what you're telling me.
So basically, within 5 or 6 doses, if there isn't a settling of the condition, you just watch the symptom and then see the response, okay? So initially, you rather dose too frequently than not frequently enough. Unlike chemicals, where you've got to be very careful. You can't overdose with homeopathy, okay? When we work with very high potency, 1M, 10M, if the patient keeps taking the remedy when it's no longer necessary, they can get the symptoms you're trying to heal. But that's classical homeopathy, very high potency. With what we do, 30C, 200C, it's very, very rare. I think in the 33 years I've been doing it, I've seen it 2 or 3 times, whereas with high potency,
Explain to us the 200C, 30C, 60C.
Okay.
Explain to us. I know that's a potency, but explain to us what the
Okay, so let's go back to the arnica, okay, for bruising, swelling, trauma, bleeding. So now we've made the mother tincture, which is poisonous to us, all right? We take 1 ml, dilute with 99 mils of alcohol, 96%. We succuss 100 times. Dr. Hahnemann, the father of homeopathy, 350 years ago, was on horseback. Okay, life was much slower then than it was today. No microwaves, no cell phones. Life, die lewe was maar stadig, né? Okay. But he found that the patients he visited, he had saddlebags on the horse. They responded quicker than the patients that saw him in his rooms. He had a dispensary in his saddlebags and in his rooms. He didn't understand the science, but it's now scientifically proven that succussion inculcates the chemical structure into the water alcohol mixture, and it's called potentization. So we take 1 ml of the poisonous substance, dilute with 99 mils of alcohol, succuss 100 times, that's a 1C. The C stands for centesimal, 1 in 100. Of that, we take 1 ml, add another 99 mils of alcohol, succuss 100 times, that's a 2C. If we repeat that serial dilution succussion 6 times, it's a 6C. Now, that's where a lot of the over-the-counter homeopathic ranges still work. It's a little bit paradigm, in my opinion. I believe the modern world we live in is much faster paced, even now than 50 years ago, never mind 350 years ago. So I work with 30C, 200C. So that process has been done 30 or 200 times. When we treat plastic, we do a 1M, it's 1,000 times potentized. You can't believe that there's any measurable molecular mass there. But we are very powerful energetic beings. Your subconscious mind is your all-knowing mind. It can see the holographic picture of the starting substance, even though it's been very potentized. Dilute, the wrong word, but still. Just so that's how the potency works.
That's very well explained. How would you like to see homeopathy sit along everyday vet list? So your everyday vetting, how would you like to see that bridge, and where does in correlation with a conventional treatment, the partner as a partner, a backup or a last resort?
No, very much. Okay, very much like within the pharmacy, it was always complementary. And more, particularly the younger doctors, are embracing it as a complementary modality to what they do, because they all know that the drugs have got side effects. The longer you use them, the side effect profile is exacerbated. So the idea is, if someone's very acute, give them the anti-inflammatory drug, for example, but then introduce the homeopathic remedy in conjunction, because it's healing the cause, not just treating the symptom. which was hugely important. So the same with veterinary. I mean, we have a number of vets who are very homeopathically orientated. The majority are not, because it's not part of their curriculum. They're quite staunch. They're very scientific, which is sad, because homeopathy is very scientific. Hahnemann was one of the early double-blind studies. He would take a raw substance, ingest it, or a colleague or a family member, hope like hell they lived, to then document the side of the symptoms that presented. And then that's how he would determine what the remedies did. That was quite dangerous. But he said he was one of the early scientists, clinical trials. He did clinical trials 300 years ago, So I would love to see it working together. If you have to treat allopathically, that's fine. But the homeopathic remedy does not interfere with the allopathic drug. It's base. That's why there's side effects. Homeopathy is elevated. It resonates at a much higher level. There are no side effects, So you can use the two hand in hand. So, for example, a number of the vets that embrace homeopathy, they use our osteofracture remedy. So an animal's been knocked over by a car or whatever, a leg is broken, ribs broken. They obviously have to do the surgery and reset it. But by getting the osteo remedy, it will knit the fracture stronger than it ever was before. The same with the injury, which you mentioned for trauma, post-traumatic stress.
What I always tell clients, so I don't want to say punt, but I genuinely believe in it. So I will say to clients that even if your dog are on antibiotics or are on some conventional medicine, start the homeopathic, start with an acute dose and get it in, because it will take over and it will surpass
exactly
the treatment plan. And I mean, for me, is a simple thing. When we met, I don't know if you remember, many years ago, it was at the in Gauteng, and I remember we were at the two stands next to each other, and I was saying to my husband, "I've got a kidney stone coming," and you interrupted and you gave me the pet renal, little renal sample bottle, small bottle, and you said, "Take this," and I knew. I knew my body. I knew I was getting a kidney stone, and I was worried that I'm not going to be able to make the next day, because I think it was 3 days or stuff like that. And I started taking that like first every half an hour that first day, and I was quite surprised by Sunday that the kidney stone hasn't made its way through to put me in hospital. And it actually, I had symptoms for quite a while, and then I could actually see that it's breaking me down. And for me, although I always believed in homeopathy, I just wasn't aware that your pet's renal will work on a human being. And for me, that was quite a great thing to say, is besides medicine, you can use that in together, and it's safe, and there's no intervention and no interference, and you actually can get good results.
Absolutely.
That is definitely not a placebo effect.
No. So, Rita, I have a standing joke, because the osteo and the renal I have in my speciality remedies over and above in the human range I'm talking about. But it was very necessary for pets. Older cats 14 years and older, will 90% die of kidney failure. And these are big cats as well. We support a couple of sanctuaries where they rescue and look after big cats. They also, their kidneys, I don't know what it is, but there's a when they're over 14, they will often die of kidney failure. But because my renal remedy you can only get from me at the office when I'm talking to patients, I will just say, go to the pet shop, get the renal. And if you start barking after 3 doses, stop, okay? But yeah, there's a complete crossover. It's not a problem,
Yeah.
So, Antoinette, there's a few questions. Are you going to deal with questions quickly, almost?
Yeah, I think if Ian can maybe just quickly run us through. Daryl asked about some more information about the blue box, and then I think maybe with that, also if there's any specific pet remedies that you think all of us must have in our house. Maybe
Okay,
throw
so
those two questions
so the
together.
blue box, let's start there. That is our flagship product, okay? It has all 28 remedies and a herbal antiseptic gel in it. The gel is colloidal silver based with calendula and hypericum. It heals beautifully. You know, the old-fashioned antiseptics like mercurochrome, methylate, they are deadly bactericidal, but they necrose the surrounding skin. So the healing actually takes a little while longer than it should. Yes, it stops infection, but it also slows the healing down. Whereas with the colloidal silver is antiviral, antifungal, antibacterial, and the calendula and hypericum herbs are very soothing, healing, and very powerful antiseptics as well, but don't damage the surrounding skin. So that blue box covers over 100 conditions. It never expires. A little 10-gram vials, 50 doses. Once the patient has bought it, they sell for about 1,390 Rand, which sounds a lot. But if you divide the 29 remedies, it's like 48 Rand a remedy. They don't expire. By law, there is a 4-year expiry date on the box, but ignore that. As long as they're kept sealed, okay? So if you save, and you know, with kids particularly, they'll get sick 2 o'clock in the morning or 11 o'clock on a Sunday night, things are closed. It's your pharmacy in a box. It really is valuable. I've always had one in my car, one at home. And my boys grew up from about 11, 12. They don't help themselves. They can't overdose. The names tell you what it's for. It really is a value. When you travel, particularly as a young mother with young children, babies, you've got a lot to pack and think about, grab your blue box. It's only this big, and you can cover 100 different conditions. So it really is a valuable thing. What was the other thing you asked?
The must-haves for our pets. So what must we have in the house for the dogs?
So in my pet range, there are 24 remedies, okay? You know, if you people go into the website, you can see them. But the trauma rescue shock, I think that's one remedy you should have. It covers injury. Say that the animal, when I say the dog, I mean all animals, is in an accident, for example, or a dog fight. The arnica in there, which is for bruising, swelling, trauma, bleeding, is at high potency, 200C. So it is good for shock. And with every accident, there is an accompanying shock. It's good for separation anxiety. So you go away on holiday, leave the animal with a carer or go to a kennel. They miss their owners. They howl and wail. It sorts that out. And they grieve as well. The ignatia in there is very good for grief and separation anxiety. So I would say if he's going to choose one remedy out of the 24, would be that trauma rescue shock remedy. Yeah.
I very often tell all my breeders that when they, and I think this is something that rescue organizations must definitely do as well. So when my breeders, when the puppies are ready to go, I say to them, get that, or if you can get just ignatia. I'm a firm believer ignatia is an excellent thing to help for grief and adjustment. And breeders that does that, say the new pet owners always say is, this dog just floated in like there was nothing. There was no mom crying for everything. So that is really a great remedy for that I use for separation anxiety and also when I deal with rescue dogs that need to be rehomed when they're in a terrible sadness and this thing, that really works very well for that as well. The ignatia is an excellent remedy for that. So it is something that I think must go home with the puppy. Every breeder must put that as part of the puppy pack into the big.
That's a great idea. Very good idea.
And if the rescue organizations just could afford having that more dogs that suffer, that gets into kennels, that's not used to it, to get that through to them is an excellent remedy. We spoke about it yesterday, Antoinette.
Okay.
It's an absolutely amazing remedy.
I was just going to ask Ian now, who in PE stocks the ignatia? Because I've got a boy in kennels and he's struggling.
Okay. So because this is clinical, the trauma rescue shock has got ignatia, aconite, arnica. It's got about 5 or 6 remedies in it, okay? But the animal, if it's in grief or separation stress, it'll pull out of there what it needs, rather than just give the single remedy.
Cool.
Yeah.
All right.
So PE, Yeah, we have
I'll
a
check
number
with
of
you after. Yeah, I'll check with you afterwards where I can get it in PE, because he's in
sure.
PE and I'm up in Gauteng, so I need to get it to him. Yeah.
Again, Antoinette, on our website, we have a where there are outlets. How up to date it is, I'm not sure. But otherwise, what I'll do, I'll give you my rep's detail, and she will tell you exactly where to go.
Okay,
You don't
Yeah,
mind?
and Pawz Raw also stocks it, eh?
Who
Pawz
does?
Raw stocks it. The Pawz
There
Raw
you go.
agents that stock as well. So yeah,
There
they
you
don't
go.
always have everything, but they get it within a day or two, so it's not a problem.
Where are your outlets, Rita?
So we've got distributors in PE, East London, Bellito, Mpumalanga, White River, then Sandton, Gauteng, that does the whole thing, and then I do the Western Cape and Garden Route.
Oh, well done. I'm in Bellito now as we speak. So
I
I'll go and
know.
visit you.
So it's only me that has got the shop front, like what
Oh,
we've
I
got
see.
in Somerset. The rest is direct to customer. They do directly to customer from their homes. We're working on getting the shops across the country. I think that it's the next new awesome thing that's going to happen. But anyway,
Okay, that's awesome.
there's another question here. Leanne has asked. She said she definitely doesn't believe it's a placebo thing. She started her boy's taffy on the Pegasus calming little pills, and I saw an immediate difference in 2 days. I also use it for him when he gets anxious during storms, or if there's quite a bit of noise in our estate. Is it okay that I'm not using it constantly or every day, but only during high stressful moments?
Yeah, that's ideal with homeopathy. You cannot really use homeopathy preventatively. It needs a symptom to act upon. So as long as the dog is in an anxious state, then the calming remedy or the trauma rescue shock is valid. So yes, she can use it as and when necessary.
Okay.
Same question from the same person. Here's another question. What is the correct way of pronouncing homeopathy? I think I've been saying it my whole damn life.
Well, in English, we say homeopathy. In Afrikaans, homeopathy, they will say.
Homeopathy.
Like we get Pegasus and we get Pegasus. We get the same thing. But homeopathy, yeah.
Okay. Here's an interesting one from Sonia. She's saying a lot of people say you may not touch the granules. Does it matter?
Okay, so that's good homeopathic principle. That really comes from the classical treatment where we are potentizing to a 1M, to a 10M. So there is barely any measurable molecular mass there. It's highly, highly energetic. Now with modern day microscopes, we can measure molecular mass up to very high potency. But because it's a very subtle medication, you girls have often got nice smelly creams and fragrances on your hand. The guys, we don't want to know, petrol, oil, whatever. So ideally, it's always 4 or 5 pillules. Turn the bottle into the cap, from the cap, pop it into the mouth. And even with the dog or the animal, cats may be a bit difficult, but open up, pop in, close, tickle under the chin here. Once they've tasted the dose once or twice, like Rita said, they like it. It's sugar. The horses love the sugar.
Okay.
And now this is another thing. So I have got 1 or 2 dogs that it's difficult to get it into them. So I always say to people, do not give it with food. Give it 30 minutes before or 30 minutes after food. What do you do when you've got a dog that does not, or a cat that does not take anything if it's not with food?
Okay, so with humans, we are more pedantic about directly into the mouth because homeopathy has got nothing to do with the stomach, the gut. It's absorbed in the buccal mucosa of the mouth. And the message, within a minute, it's gone. You can then eat, drink, do what you like. Okay. But if someone's had coffee, well, we're not talking animals, I'm talking generally now. If you've had a cup of coffee, then yes, you should wait 20 minutes, half an hour, because that's a very peppermint coffee toothpaste. Not good for homeopathy. So that doesn't apply to animals, okay? But even with humans, within 1 minute of sucking on a clean mouth, the message is gone. I do say if you're taking more than one remedy, have at least a 10-minute gap, 15-minute gap. But with animals, as I said earlier, they get the message so much quicker and clearer than humans. So you can put it in the food. Prize number one, in the mouth. Birds, for example, or other reptiles, you can crush 10 pilules in a bowl of water. Don't use metal, preferably plastic or ceramic, because metal may impart a magnetic resonance, okay? But you can crush the pilules and add it to wet food, and they get the message, no problem. Even babies, human babies, crush it in the milk, in the breast milk, in the formula. It works.
Okay, that is great. Okay, I just want to see. Daryl has asked, do we have to mix these remedies for our doggies? Is there a guide for us, especially for people like me who have no pharmaceutical or veterinary experience? So, if I get it right, Antoinette, help here. Do we
I
have to
think
mix
what
the
is maybe
remedies?
asked,
I
maybe
didn't
if
quite
it's
get the
different.
question, okay? Sorry?
Yeah. I think maybe what Daryl means is if the dog has to take different remedies for different
Right.
symptoms,
Yes.
it's okay to mix that. Like you said just now, maybe if they have to take different ones, leave a little gap of 10 or 15 minutes in between.
Correct.
Am I correct?
Correct.
Yeah.
So a perfect example there is the otitis remedy, where they have ear issues. We often give the mucodranol with that remedy. In the humans, mucodranol with sinus, because the mucus gets thicky and sticky in the ear, causes congestive pressure, and that's where your infection will lodge. So it's important to to drain the mucus. But where you are getting two remedies like that, you don't want to scramble the message. So at least a 10, 15-minute gap, or you alternate the remedies. Okay.
So
Okay.
I
And then,
want
Ian,
to.
just the second part is about the veterinary experience. Obviously, can you hear me, Rita?
Yes.
Sorry. Just the vet or the homeopath will tell you what to take. Am I correct? It's
Not with
because
you.
his second question is, so what is the guide, especially for people who do not have a pharmaceutical or veterinary experience? So
Okay.
I'm just a regular pet parent. I'm not a vet.
Yeah.
I'm not a pharmacist or a pharmaceutical person. So how do I know what to give?
Okay, so that's how I've designed it. For ease of use, the names pretty much tell you what it's for. So, for example, the one remedy is called aggression. So that is for dogs, often rescue animals, where you don't know what's happened to them when they're puppies. They were beaten, they were teased, attacked by a bigger dog. So they're either very fearful, very timid, or overly aggressive. Now they've got a new owner, they're overprotective. Homeopathy will always bring back to homeostasis. It'll balance out, okay? So it tells you pretty much aggression, fear. Calming tells you what it is. Dermatitis is for more serious, unhealthy skins. The sting and itch is for allergy-induced itchiness. And, they ignore it, their paws, and they're rubbing all the time. Kennel cough tells you what it is. Renal, kidney. So the remedies pretty much tell you what it is. And the big thing is rather initially dose too frequently than not frequently enough. But as soon as you see a response, then you start slowing it down. So an average dosage, say I've got a dog with kennel cough, okay? I would dose, if it's practical, the owner's with the dog, if they could dose every hour for the first 3 doses, then every 2 hours, the next 3 doses, then sort of 3 times a day till well. And going back to your earlier one, if that dog has not responded well within 36 hours, it's getting worse, you see your vet straight away. Okay, that's important. Yeah.
I know on your website you've got an amazing remedy finder
Yes.
thing. So whatever. What I'll do is I'll post the link in comments after the show so that people can see, Antoinette. And when we do the recording, just post the link of the finder, because that's extremely helpful, and it actually gives you. It's very easy to follow. It's a layman can really follow this.
Yes. In our little blue box, we have a little booklet that goes in there. It tells you each remedy, what is in the remedy, what they do in the context of that condition. And at the back of it is the same remedy finder. Yeah. But it's on the website.
That's brilliant. Basically, just read the box.
Yeah.
And read the box. Guys, I want to move on to a conversation for me that is something that I feel people need to investigate a little bit more. And for me, this is really, it's the vaccine conversation. Okay. Now, just for disclaimers, I want to say we're not anti-vaxxers. We're not saying vaccines are terrible, but there is alternatives. And I think initially when vaccines was developed, it was a much more natural process than what it is and ended up being in later years. And therefore, I would say is vaccines are where natural and conventional pet care often collide. And where you personally land and what you get's oversimplified on both sides. So, Ian, tell us your view on vaccines.
Oh, now you're putting me on this. This is very contentious, isn't it? So you're putting me on this.
So where does homeopathy have a room and a place in the vaccination world?
So let's go back to Dr. Hahnemann. He was a pharmacist and a doctor and a very forward-thinking guy. He was disillusioned with the practice of medicine in the 18th century. And he bad-mouthed the practice of medicine. They were bloodletting in those days. The Lancet medical magazine, the journal, the little instrument they would stab you with and bleed you. The last thing you need when you're dying of something, your blood carries your life source, okay? They were giving crude substances like mercury and arsenic. However, mercury and arsenic in homeopathic potency are incredible healing remedies, okay? Arsenic in homeopathy, it's called arsenicum alb. It is one of the finest remedies for gut rot. If you've got serious diarrhea, cholera, that's your remedy of choice, okay? Mercury, Merxol, incredible for infections in the mouth. It is broad, very valuable. So Dr. Hahnemann said, a healthy man will be healthy in a sewer. So what he meant by that is if your immune system is intact, you can go through an epidemic, a pandemic, okay? So I will never tell patients not to vaccinate. What I say to them is, my boys have never been vaccinated, okay? They've done the homeopathic homeoprophylaxis, okay, where we take the nosode of the disease tissue or whatever, we then homeopathically attenuate it. That's a nosode. And we will give the nosodes of the various viruses that the vaccinations are there for. So really it's all about the immune system. You want a healthy immune system. You've got things like rabies. Now, rabies can be deadly, okay? And I think it's legislated, you have to do it, not so.
Yes.
Yeah.
Yes.
So that's the one vaccine I would say, yes, have it done. But what we can then do is we can detox the animal energetically post the vaccine. Okay? My understanding is vaccines of old were valid, where the theory is very valid, where you take the attenuated diseased tissue and you then it's diluted. So there's no very, very, very low titer of the original substance, but it will initiate the immune response in the body. That makes sense, okay? But the modern vaccines post-COVID, which was an evil agenda, and that's my opinion, and I'm certain of it, they're now mRNA. So they now change the genetics of the organism. That's a problem. That's a problem, because you can't reverse that. Okay? So parvo, for example, another dangerous disease, okay? Especially in young puppies. The symptoms are diarrhea, cramping, vomiting, a dark stool, a lot of stool. So in my DVC, the diarrhea, vomiting, cramping, I have the parvonosode. So we've taken the parvovirus, homeopathically attenuated it to 30C. So that should short circuit the parvovirus taking hold. Okay. So in humans, we do the entire government protocol in oral homeopathic homeoprophylaxis. Okay. We can treat like that. That's what I did with my boys. If I had a lot more and more young mothers coming to me where the child has had the vaccine, the schools will tell them you cannot come into the school if you haven't been vaccinated, for example, which I don't think is legal, but it's what it is. So I will then treat them homeopathically that way. If they've had the vaccine, we do a single dose detox at 200C. So it energetically detoxes the body without detracting from the efficacy of the vaccine. So that's what we do. And recently, I've been able to acquire the entire vaccine protocol for equine and canine. So there we would do the same thing. If a patient chooses not to vaccinate, we can do the treatment homeopathically. If they've had the vaccine, I would highly recommend they do the detox. It will do no harm to the animal. It doesn't detract. If they've had the rabies vaccine, it's still going to work as it's designed to do, but we can energetically diminish the side effect profile energetically for that animal.
That is such good news. Yeah, that is actually such good news, because I very often find is that breeders vaccinate too early for whatever reason, and then they actually nullify the efficacy of the vaccine, of the mother's natural immunity, and then all of a sudden you're actually sitting with a puppy that's got no immune. There's no antibodies starting, and very often then there's over vaccination with follow up 2-3 vaccines 2 weeks apart, or 3. I've literally seen 2 weeks apart, and you are cancelling out you don't give the body the time to actually build up immunity with that. Exactly. And in this instance, if you then start adding the nosodes to this, you are going to actually rectify and give better immunity to that. Am I right in saying that?
All about the immune system. So animals in the wild, that's why rabies is a dangerous one. Wild domestic animals are cosseted. They're at home, so that the chances are much more slim that they would succumb to something like that. But in the wild, the animals they're more exposed, and therefore their immune systems may be compromised, and they then could succumb. They're in contact with lots of other animals. So that can be a problem. So I know recently I've had equine people come to me where they stable their horses at stables, and they are forced to vaccinate, otherwise they cannot be stabled there. And you can understand where the owner comes from, because they're interacting with a number of other horses. Okay, if you've just got 1 or 2 horses on your small holding, the chances are the risk is much less. But with those serious ones, vaccinate, but then do the detox. And also, if they've been vaccinated, some of the scary thing in the vaccines is heavy metals. Okay,
that is the biggest problem.
Yeah, so we would do a metal chelation to remove the heavy metals. You do that about a week or so after the vaccine. Let the vaccine message go through, but then you want to detox the heavy metals. I would treat the liver. We take our liver tincture as a complex of herbs specifically for liver, gallbladder, and we add Artemisia annua to that. I would treat the kidney and bladder, do a little course of kidney and bladder, just help the organs that have had to deal with the processing of that very invasive medication.
Okay. So when a lot of things that pet parents don't understand or realize, because vets does not share this with them, is that, say for instance, your puppy had the parvo vaccine, it sheds. So a few days afterwards, it sheds. So if you can have a healthy adult dog, actually, and it sheds, and if that dog's immune system is just taking a little bit of a dip, then you can give power to your fully vaccinated dog because of shedding. And we don't do we do power just as a puppy, and then never after that again, because it's most only a puppy disease. So how would this nosodes help with shedding and the effects that vaccinations has got on other animals around you?
So you're talking about
Do you understand?
a parvo-vaccinated dog may shed onto others that it's in close contact
Well,
with.
I think it's the first 2 weeks after the vaccine they shed. They shed
Okay.
the
So,
virus,
so
yeah.
so that's why I said within a week of the actual allopathic vaccination, do the detox. That should stop the shedding. Yeah.
Okay.
And build the other dog's immune systems up. So in my human range, the immune defense remedy would be a good one because it doesn't overstimulate the immune system, it modulates the immune system. So that would be a good thing to do. Do the detox, immune system.
So something that I've been doing, okay, and this is now before mRNA vaccines came in, whenever my dogs had to get vaccinations, I would 2 or 3 days before, I would give them Tuja and sulfur, and then do it for 2 days before I started, and then up until 2 days afterwards, to help for the detoxing and the not necessarily the vaccine part, but that is part the heavy metals that's in the vaccine and the other side effects to help assist them go through that. And I've always found that it is an absolute amazing, let's call it vaccine injury remedy to help.
Yes.
From
We
that point
do
of
the
view.
same with the humans, where we do the thuya 3 times a day for 3 days before and after. And it does seem to detract negate the side effects of the vaccine. Eh? The detox is the best because there you're giving the nosode at a very high potency. So energetically, it will desensitize.
Okay, that's great. No. So a lot of people has got no choice. They need to take their pups to puppy daycare, and kennel cough is the go-to vaccine, which is for me actually so ridiculous because it only works after the second vaccine, and it covers only a few strains and stuff like that. So your kennel cough remedy is a good thing to give dogs. I normally say to people, start doing kennel cough if your dog needs to go to, if it needs to get the kennel cough vaccine and go to daycare or kennels.
Puppy
like
school
that.
or whatever. Yeah. And then you would just give 1 dose a day while they're at the event, be it puppy school or whatever. Yeah.
Yeah, so that's another must-be product in your pet case. Kennel cough,
Yeah.
injury.
Injury, great remedy. Yeah, there are 24 of them, so you just need to go through them, but they're all valuable. Huh?
Yeah, no, it's just when you think you don't need, I don't have this, whatever, then I think, oh my God, now I need it. So I make sure I've got everything in my pantry because you do need them sometime in your life.
Rita, it's like the blue box. Some people will say to me, but I never use the bites. I wouldn't get bitten by a snake or a scorpion. But it's in the box. 5 years down the line, you're in the bush and something happens, that remedy is still fine. Unlike
I remember so clearly at the summit last year in Joburg, halfway through Sunday, one of my clients got a phone call from her husband saying that her puppy, a 1-year-old Weimaraner, was bitten. They think it was bitten by a snake. They saw the dead snake there. It wasn't a very poisonous snake, whatever, but the puppy was very swollen. And I remember she went home with a bites remedy and stuff. And I think that actually helped because she went home immediately, took the remedy with it. I think you went there, I spoke to your rep there, and she grabbed everything and ran through it. And I think that actually made a lot of things. The dog did get damaged in the long term because it was of it, but that helped the dog to get better quicker. So it's always good to have something like that. If you're not sure, bee sting, do things like the bites, the sting. I can't remember all the names now. My brain is fried. But yeah, it's there's a place for every single thing.
So talking about bites, I was working in Windhoek, and there's a pediatrician and his son there. Their hobby is studying poisonous things. And in the Namib Desert, it's got one of the highest rates of scorpions, centipedes that are poisonous, snakes, obviously. And somehow we're talking, he's a pediatrician, so we talked about the mucodrainal and the TV pain and fever, but somehow it came out about his hobby. So I told him about the bites remedy, and he didn't go mad about it. Then we were at the conference, the pharmaceutical conference. I was talking about homeopathy, and he was talking first. And here the slide comes up with Pegasus bites all over the screen. Okay, that's cool. And he says, hy sê in Afrikaans, die beste ding vir slangbyt is karsleutels. Jy klim in jou kar en jy ry. But a lot of those farmers, the farms are like 2 hours away from the closest town. It's a huge thing.
You start giving it.
That's when you start sucking these pillikies of Pegasus. Trauma rescue shock, for the shock, bites every 10 minutes apart. You start sucking them, get in the car, get to help. And often by the time they get there, they're fine.
Yeah. Well, hopefully if all goes well. So, yeah.
Wow.
Antoinette, you've been really quiet.
Yeah, no, I've just seen is a good question from Mr. Miyagi Lindy. What would be the go-to homeopathic approach to be supportive care for healthy teeth and gums?
Okay.
This is obviously for dogs. Yeah.
So that would be the osteofracture remedy, which is in the range. Okay.
Yes.
On the human side, we do a tissue salt. It's called the dental tissue salts. I've got she's an aesthetics practitioner, maxillofacial dental specialist and she loves that remedy. She gives it to all of her patients where the teeth are crumbly or breaking or just not healthy. So the osteofracture would be that remedy. Yeah.
And for tartar buildup?
For what? Tartar?
Tartar. Fragaria.
That's a good question. I'm not sure.
There is a remedy, Fragaria.
I don't know.
I've got it somewhere, but I can't remember it out of my head. That's Fragaria something.
What we do, we have that herbal antiseptic spray. We often, when there are mouth issues, gingivitis, etc., we just dilute it a little further, and you can just spray it onto the gums.
I want to see how I'm going to get these beagles to open their mouth. That's yeah.
Oh, crazy.
Yeah. Anyway, I think we've covered all the questions. I'm just going through my questions.
Ian, can I just go? Sorry, Rita. Can I just go back to the no-sodes because especially with the puppies. So, what would it look like? If you would be giving the no-sodes, at what age do you start typically? What's the kind of frequency? If I don't want to vaccinate the puppy, but I'd rather go that route.
So again, you'd only use the no-sode if there's a symptom for it to act upon. So a no-sode is where the starting substance is from an inactivated, diseased tissue. Okay. So for example, in my antiviral bag, we've got penicillinum. So from the original culture of penicillin, we've homeopathically attenuated it. So that's a no-sode, where it's the starting substance is from diseased tissue. The other example there would be tuberculinum. My constitutional remedy is tuberculinum. I've never had tuberculosis, but my forefathers would have. Syphilis, gonorrhea, tuberculosis were common diseases. TB still strong in our indigent population. So we take the starting tuberculosis infected tissue and then homeopathically attenuate it to the point where there's no tuberculosis there, but the holographic picture is, and that can help the body treat TB or chest. If I get very run down, I will get a cough, irritating little cough. That's typical tuberculosis, tuberculine, for example. Influenzaanum, we take the influenza virus sputum, homeopathically attenuated. That's a no-zone. Whereas a sarcode is made from healthy tissue, often glandular things like thyroidinum. So we want to treat the thyroid, overactive or underactive, we'd use the sarcode of thyroidinum. So that's the difference. Does that answer your question?
Yeah, I'm going to have to sit with this for a little bit. But yeah, we're just running out of time, and I don't want to take up all your time.
Yeah.
I know. Yeah.
So just last thing on the vaccines. If the animal, I would say post-COVID, that all the vaccines now are mRNA based. People don't know that, but it's what I think is happening. So therefore,
it's definitely going that route. It's not all of it yet, but it is definitely going that route. It's
way.
more and more
So
happening. And we don't know that.
No. So yeah, it's just a surmising. But if that's the case, then radionics is quite useful, where you take the sputum of that horse or dog. And I have a colleague, she's from Bavaria. She has a very powerful radionics machine, and she can energetically produce a remedy. And via a USB stick, MP3, you would put that on the horse with that frequency. And that can then set the DNA back to its original state. Quite interesting. But that's a whole different thing.
That's another hour or two.
Yeah.
Brilliant.
What is the biggest misconception about homeopathy that you'd like to clear up for people tonight? What's your take-home message there?
Okay, I'm glad you asked that, because one of the most common things I get is that it takes a long time to work. Okay, so where that comes from is classical homeopathy. If I'm treating a patient classically, we're trying to find the one single remedy that is that person, their constitution, hulle gestel, their personality. We're all independent. So it's like peeling layers off of an onion. The first lot of symptoms will present, you treat that. You go deeper, and that can take weeks and months, okay? And I think that's where people get the idea it takes a long time. With clinical homeopathy, within 1 to 3 doses, we will see a response to the symptom, and then you know the constitutional healing is happening. So that's a quick case. I had a guy in Namibia again. He came towards me. We're at an expo there, and he was sort of staggering, and his left eye was droopy. I thought he was having a stroke. He had a severe migraine, full-blown migraine. And migraine, even with allopathic drugs, is not always easy to treat. I gave him the homeopathic migraine remedy, Pegasus. I told him take a dose every 10 minutes. About 45 minutes later, he came back, was nice and busy there, and I could see he was fine. The eye was sparkly, and he was fine. So I was fascinated. How many doses? 1 dose. So his constitutional remedy is in that remedy. And if it's the right remedy, it's like a silver bullet. Boom.
Sure.
Yeah. So that's the one thing. And the other thing, the placebo, which we've spoken about, it's so much more than placebo. I think that's a no-brainer. Yeah.
And we have spoken about this. Actually, you cannot do any harm with any of your remedies. It is really safe. You can't overdose. There's no interactions with other meds and stuff like that. So that actually takes all the red flags that people can say about homeopathy away in terms of it is actually perfectly safe. I mean, it's safe for pregnant bitches, it's safe for puppies, it's safe for older people, older dogs, and the same for humans as well. Homeopathy is in general a very safe.
Just recently, my bookkeeper breeds Maine Coon cats. That's her hobby and sort of a sideline business that she has. And she introduced some of my maternity remedies to her breeding colleagues. And they used the birthing remedy, they used the lactation remedy on the cats, and they respond amazingly. So it's no placebo, it works well.
Yeah. It is definitely something that I think for our listeners that is breeders, and I've got lots of clients that's breeders, is something to look into, to have some of the remedies. So Ian, here's the question. If we have got anything specific, I know I contacted you a while ago about a client that has had a specific thing with high pancreatitis issues, whatever. You are available in order to do more specific remedies for pets?
Absolutely. So, recently the equine arena has sort of got onto homeopathy, and I designed a spinal skeletal remedy. So old racehorses who've been ridden hard and their spines will often start concaving. I use that for my human patients as well, spinal skeletal. We had a lovely feedback the other day, a rescue center in Noordhoek, and they've got these old retired police horses and just rescue, but they're all old horses, they're well over 20. And 3 of them had laminitis, the hoof infection. To the point they were going to put the older horse down, because what happens, they can't even stand on their feet. It's so painful. They've got to put them in straps, and they just put them down. I sent the laminitis, I designed the laminitis remedy, sent it to them. I told them to give it 3 times a day. She phoned me a week later to say she gave it once a day. The horses are running around the paddock, all 3 of them, in 1 week. It's just beautiful, hey? Yeah.
Yes, that is beautiful.
The vet would have put the horse down, the one.
Yes. So we have got to say goodbye. I wish we could do this for another 10 hours because it's so interesting.
Yeah, I can't feel that with you.
But where can they find you? They can definitely book their tickets to the African Pet Health Summit.
I was just going to say, yes.
One of our speakers. So that's going to be amazing.
Yeah.
So Pegasus is also one of our sponsors, which we're very grateful for. And if you want to get more of Ian's knowledge, whatever, book your tickets, guys. The tickets are selling out fast. So
wonderful. You do good work. Thank you. Great.
And thank you, Ian. Thank you so much. South African Pet Health Summit, where they can find you. Where else can people find you?
You can my email. They can email the office actually. It's info@pegasushomeopathics.com. Maybe you can put that up, Rita.
Yes.
Or they can ask us. We can also put people in touch with you. That's easy enough.
But they're welcome to email me, and I will get back as fast as I can.
Okay, perfect.
You will definitely be getting an email from me, Ian, because I've got a few things that needs to be solved.
Do that, and then we'll chat. Okay, as well. No
Brilliant.
No, for me, it's spreading the gospel of homeopathy. That is my passion, and I love it. Yeah.
So good.
Yeah, thank you very much.
Thank you so much.
Yeah,
really,
thank
really
you for the viewers as well, and for the great questions. Yeah,
you don't do too badly for 2 aunties. I've got to tell you.
I'm sitting like this, Ian. It's like, please hold, please hold.
Yeah, well, good.
This was a great episode. Yeah.
All right.
Oh, brilliant! It was lovely to meet you.
Likewise. Have a good evening.
Thank you very much.
All right.
Have a great evening. And enjoy Ballito, the warmer weather. We'll see you back in Cape Town soon.
We're going to have a swim in the warm water.
Good luck.
All right.
Bye-bye. Just before we go, Antoinette,
thank you.
Who do we have next week?
Rita, you do this to me every time. I forget. I get so engrossed with the conversation. Don't do this again.
Okay, I won't do that again. We'll post this. Sorry, guys. Keep on. Have a wonderful week. Right. Stay warm.
Have a good evening.
And give your furries a hug. Keep on.
Thank
Bye.
you. Go well.
Thank you.
Ciao.
Bye.
How do I get out of here?
Bye.
I don't even know how to get it. Oh, there you go. Bye, guys.
Come on, word.
Okay.
Bye. Bye.